Hello and good day. My name is Teacher JV, and today we will be learning the chapter 11 of your anatomy and physiology. Now let's start. Okay, on this one, we'll be learning about the blood. Okay, and first we're going to tackle the functions of the blood. What are the responsibilities or the things that is being done by our blood in our entire system? Okay, so the first one is it transports gases, nutrients, and waste products. So we all know that blood is liquid and it moves. Now, that is why it's easier for it to transport anything. Substances can go in and out of the blood easily. Example is the oxygen. It enters to our body through our lungs. Then it will mix with the blood to be carried to the cells. In return, the carbon dioxide produced by cells, it will also mix again with the blood and then expelled through the lungs as well. Okay, now nutrients, ions, and water from the digestive area will also be transported by blood going to various cells. And also the waste products being transported by the blood into the kidney that is due for excretion. Okay, the second one, it transports transport of processed molecules. Okay, there are many molecules that will undergo series of processes before they are being utilized by the body. Now with that, the blood is responsible to carry these molecules to the origin of site going to the area where it is being processed. Okay, same as here on the third one, transport regulatory molecules. The next is regulation of pH and osmosis. Now, remember the buffers that helps maintaining the blood pH within normal, and our normal blood pH is 7.35 to 7.45. They can be found in blood. Okay, now while the osmotic composition of the blood, they are critical in maintaining the normal fluids and ions. The next one is maintenance of body temperature. With this one, it has something to do with your metabolism. Now, the heat is being produced with your metabolism, and then it will warm the blood. The warm blood is transported from the interior part of the body going to the surface, which eventually help the regulation of the body heat. The next one is protection against foreign substances. Okay, there are cells and chemicals in the blood that are crucial for our immunity, in which we're going to learn later on. And the last one in here is all about the clot formation. Okay, remember, I think we touched this one in the previous system, in the if I'm not mistaken, in the skeletal system. Okay, or muscular, like when we are injured or we have a wound. Now the blood will do the clotting mechanism so that it will prevent excessive blood loss. Okay, so these are the major functions of the blood in our body. Now let's move on. Okay, so this time we're going to talk about the characteristics of blood. I know you're well aware of this one. You've seen this one. It's because you have this one. Okay, so it is a type of connective tissue. The consistency is sticky and it is heavier than water. Now the O2 content determines the color of the blood. If it's less oxygen, or if it has normal oxygen level, the color varies. Temperature is slightly higher than the rest of the body. The normal level of blood for males is 5 to 6 liters, while the females is 4 to 5 liters, while the blood is 8% of our body weight. Okay, remember those numbers and remember the characteristic of this one. So let's go here. We're going to talk now about this one, the composition of blood. So maybe you've already experienced undergoing medical tests wherein they're going to draw blood in your body, just like what is happening here in our illustration. So this is being done by a professional, maybe a med tech, a doctor, or it can be also a nurse. Okay, so when our blood is being drawn, then they will try to separate the characteristics or the compositions of the blood. It will be like this. It's like 55% is plasma and the 45% is what we call the formed elements. Okay, now this 55% total blood in the plasma, the color is usually yellow or pale, and this one surrounds the cell. Okay, 91% of which is water. Okay, and it also have proteins, which is 7%. These proteins compose of your albumin, globulin, and your fibrinogen. Okay, we also have 2%, which are the other solutes in the plasma. Okay, and we've said here that the plasma contains your proteins. The first one is your albumin. Your albumin is most likely 58% of the plasma proteins. And whenever you hear albumin, it has something to do with maintaining the water balance in our body. The next one is your globulin. Globulin is 38% of plasma proteins. And globulin helps in your immune system, while your fibrinogen is 4% of plasma proteins. It usually aids in the clot formation. Okay, so that is all about your plasma. Now let's go here to your form elements. In form elements, which is 45%, the composition of this one is platelets, white blood cells, and your red blood cells. Okay, so 45 your form elements are cells and cell fragments. Okay, as you can see here, 250 to 400,000 is your platelets, 5 to 10,000 is white blood cell, and 4.2 to 6.2 million is composed of your RBC. Okay, and we also have subcategories or subdivision of your WBC, which are your neutrophils, lymphocytes, monocytes, eosinophils, and basophils. We're going to discuss this one by one. Okay, now let's move on. The production of form elements. Okay, how the form elements or how these elements are being produced. Okay, we have this what we call your hematopoiesis. Hematopoiesis is the process that produces formed elements, and this is continuous all throughout our lives. Okay, so it will start actually when we're still fetus. This one, it will be on the several tissues, being done on the several tissues in our body. Okay, and then the next one is after birth. In afterbirth, it is being produced mainly in your red bone marrow, just like what is happening here. Okay, and we also have your WBC, which at some point they're being produced in the lymphatic tissues. Okay, but mainly after birth, they are being produced in the red bone marrow, and they are being produced with this one, with your hematopoietic stem cells. Okay, your hematopoietic stem cells, which eventually it will reproduce these different forms, the RBC, WBC, and your platelets. Just like this illustration here, as you can see, Again, the stem cells, or what we call your hemocytoblast stem cells or hemocytoblast, they will give rise to different cells, the one that I mentioned a while ago, your RBC, WBC, and also your platelets. Now let's go here. As you can see in this illustration, this is the stem cell, and then it will give rise to different cells here. Okay. Moving on here, let's talk the first one, which is your erythrocytes. Okay, erythrocytes, or your RBC, or your red blood cells. As you can see here in this illustration, it looks like this one. Disc shape with thick edges. So you can see if you're going to compare it with your WBC and also your platelets. Okay, so this one, it is disc shape with thick edges, and nucleus is lost during the development. Okay, so your RBC doesn't have your nucleus. They usually live for about 120 days. Okay, main function of your RBC, transport oxygen to tissues. So that is your erythrocyte. So moving on here, on the next illustration, this is what we call your hemoglobin. Okay, hemoglobin, the main component of your erythrocyte, transport oxygen, and each globin protein is attached to a hem molecule. So the example is this one. This is your hemoglobin, and we have here your heme molecule. It says here each heme contains one iron atom, which is this one. Now, the O2 binds to your iron. Once that happens, we will be having your oxyhemoglobin, the hemoglobin with an oxygen attached. Okay, so that is your hemoglobin. Now moving on here, or let's go back here first. So I put an emphasis here on iron. Okay, iron is very important for the transport of the oxygen, and also the women need more dietary iron than men do, because women lose iron as a result of monthly menstruation. And sometimes there are people, or there are women who are receiving or having your iron supplements. Okay, that's how important iron to our body. That is why mostly iron can be found in our blood. Now let's go here, the production of your erythrocyte. How does RBC is being produced? Now what is happening here is, in this pathophysiology, is that there's going to be a decrease of blood oxygen. If the body thinks that our system is having a low blood oxygen, the body will top the kidney. Okay, the body will top the kidney. It will stimulate the kidney, so that there's going to be an increase of production of your erythropoietin. Okay, so a decreased blood level, it will stimulate your kidney. Eventually there's going to be increased erythropoietin, or your EPO, which is being manufactured in the red bone marrow. Okay, now erythropoietin stimulates the red bone marrow to produce more erythrocytes, and in return there's going to be increased erythrocyte that will cause, or that will now increase the blood oxygen of the body. So this is the simple pathophysiology of the production of erythrocyte. So low blood oxygen level being detected by the body, then it will stimulate the kidney to increase production of your erythropoietin from the red bone marrow. Eventually there's going to be more erythrocytes, and then it will elevate, or it will increase the red blood cell production, and it will increase the blood oxygen in the body. I hope this one is clear, so that let's move on here. Now, what will happen to the old erythrocyte and hemoglobin in our body? So we already know that they're macrophage. We already learned that one. So what is happening here is the old RBC are removed from the body by macrophage in our spleen and or in our liver. Okay, so as you can see here, hemoglobin is broken down. Now, once the hemoglobin is broken down, it will now broken down into your globin. Okay, now what's with this globin? The globin again will be broken down to produce more amino acids. Okay, so that is the globin part of your hemoglobin. Hemoglobin will be broken down into globin, and then it will be broken down into your amino acids. So what will happen to the heme part of the hemoglobin? So what will happen is that hemoglobin's iron is being recycled. So that is what's happening. Okay. Now, the heme is converted into your bilirubin. Okay. The bilirubin, this is the yellow pigmentation or yellow pigment. Okay. And then once it is being converted into bilirubin, the bilirubin is taken up by the liver and released into your small intestine as part of bile. Okay, this bilirubin is also responsible for the color of your feces. Okay, that is why it is color yellow. But what will happen if there is how do you call this one, occlusion, or the distribution of bilirubin is being hindered? Okay, we have this what we call jaundice. Okay, jaundice, this is happen if the liver is not functioning normally, or the flow of the bile from the liver to your small intestine has occlusion. Okay, now if there's an occlusion, the bilirubin will build up now to our blood. It's because it cannot flow freely going to your small intestine, so it will go back to the blood and then it will build up. Now the excessive bilirubin will now be deposited in other tissues, in our skin, in our eyes. Then it will result to the condition which is what we call jaundice, just like this one, yellowish discoloration. Whenever you see this one in the emergency room or medical room, or someone that you know that the color of the skin is yellowish or the sclera of the eye is yellowish, you can conclude that that person has kidney problem, okay, or has bilirubin problem. Now let's go here. So after your erythrocyte, we will now move on to your leukocyte or your WBC, your white blood cell. This one, they lack hemoglobin compared to leukocytes, and they are a bit larger, as you can see here in the illustration. Okay, a while ago we said that your red blood cell, they will lose nucleus during the production or growth, while your WBC, they contain nucleus. And the main function of this one is to fight infections. They remove dead cells and debris by your phagocytosis. You still remember your phagocytosis, engulfing or ingesting dead cells. Okay. Now here, this one, if I'm not mistaken, you've learned this already in your senior high school or any other science subject, the types of your leukocytes. So what we have here are your granulocytes and your agranulocytes. Agranulocytes, okay? From the term itself, granulocytes, it contains granules, while the other is otherwise, okay? It doesn't have granules. So granulocytes, we have your three examples here, your neutrophils, basophils, and eosinophils. While your agranulocytes, we have your lymphocytes and your monocytes. So in your neutrophils, this is the most common type of granulocyte. They remain in blood for 10 to 12 hours, then they will move to tissues. and this is usually for you by your phagocytes. Okay, now what will happen to the dead neutrophils here? Dead neutrophils, cell debris, and fluid can accumulate as pus at site of infection. Now let's go to your basophils. Basophils, this is the least common. Okay, they release histamine. Histamine is for your inflammatory reaction, and also they release heparin. Heparin is anticoagulant. They prevent the formation of clots. Okay, most common neutrophil, least common basophils. So we have the last one, which is your eosinophils. This reduce inflammation. Okay, the inflammation such as your allergies and your asthma. Okay, let's move to the other side, your lymphocytes and your monocytes. Your lymphocytes usually is for the immune response. Several different types like your T cells and your B cells. While this one, it will lead to production of your antibodies, your lymphocytes. While your monocytes, they are the largest and they produce macrophages. Okay, so I hope this one is clear. Types of leukocytes, we have two: granulocytes with granules, agranulocytes without granules. Granulocytes, we have neutrophils, basophils, eosinophils. Agranulocytes, we have monocytes and your lymphocytes. Okay, let's move on. Platelets. Okay, so this term I hope is very much familiar with you already. So what are they? They are the blood clotting cells and produced in the red bone marrow, specifically in your megakaryocytes. So this is your platelets. They are the one responsible for blood clotting. Now let's move here. So what will happen if there is blood loss? You already know. When blood vessels are damaged, blood can leak into the other tissues and disrupt the normal function, especially if you cut yourself or it's due to vehicular accident or any accident. Okay, there's going to be blood loss. Now, blood that is lost must be replaced by production of new blood, which is it will take time to produce blood. If there's going to be excessive loss, blood transfusion is the most convenient way to prevent hemorrhage. Okay, now let's go here. Preventing blood loss. How are we going to prevent blood loss? By using our own body. So what is happening here is there's going to be injury. So there's breakage in the skin and the blood vessel. It means the flow of our blood is being disrupted. Okay, so we have here three ways to prevent the blood loss. So we have your vessel spasm, we also have your platelet plugs, and also your clotting factors. Okay, or I mean your blood clotting. Vascular spasm. So as you can see here, there's spasm happening on this part. This is the site of the injury. So in vascular spasm, there's going to be temporary constriction. It means really it. Okay, constriction of blood vessel. So what is happening there? There are smooth muscles within the wall of these vessels, right? And then what will they do? They will contract. They will contract so that it will stimulate. Now, in this contraction, it stimulates your thromboxane, and also your endothelin. Okay, this stimulates the vascular spasm. Okay, after which, let's move here. We have your platelet plug. Okay, so in platelet plug, what we have here is your platelet adhesion and then your von Willebrand factor. What is happening here in platelet plug is it can seal up the small breaks in the blood vessels. Now, in platelet adhesion, platelets stick to the collagen exposed by the blood vessel damage. Now, your von Willebrand factor forms the bridge between the collagen and also your platelets. Okay, and the last part here, what we have your blood clotting or the coagulation. Okay, so we have here your clot. This is the clot that is composed of your fibrin. The fibrin, it will trap the blood cells, the platelet, and also the fluid. Okay, and the next one is your clotting factor. The clotting factor, proteins in plasma, only activated following an injury. And then this is usually made in the liver, and it requires vitamin K. Okay, so moving on here, this is the steps in the blood. This is the steps in blood formation. So what is happening here is there's the injury to a blood vessel cause your inactive clotting factors to become activated due to the exposed connective tissue or release of your thromboplastin. The next thing that will happen is your prothrombinase, your prothrombinase, that is your clotting factor, is formed and act upon your prothrombin. Now, the prothrombin is switched to its active form, which is your thrombin. The thrombin activates your fibrinogen into its active form, which is the fibrin. Now, the fibrin forms a network that traps your blood. Okay, so that is the step in your clot formation. Moving on here to the next slide. Control of blood of clot formation. Clots need to be controlled so they don't spread throughout the body. Anticoagulants prevent clots from forming. Example are your heparin and your antithrombin. Injury causes enough clotting factors to be activated that anticoagulants can work in that particular area of your body. Now, so we have also here what we call your clot retraction and your fibrinolysis. Okay, as you can see here in this illustration, this is how it looks like in your clot retraction from the word itself. And here, fibrinolysis, lysis. You're familiar with that term, right? So in clot retraction, condensing of clot, serum in plasma is squeezed out of clot and help enhance in your healing. Well, here in fibrinolysis, a process of dissolving the clot. Plasminogen, your plasma protein, breaks down clot, which will proceed to your fibrin. Okay, so here, the next one, this is your fibrinolysis. So this is how it is being done. Thrombin, this one, and the tissue plasminogen activator convert your inactive plasminogen into your plasmin. Now, this plasmin, it will break down the fibrin, this one, in a blood clot, resulting in your clot fibrinolysis. Okay, as simple as that, the pathophysiology of this one. Now, let's go here to the next one. This is what we call the blood reactions. Okay, so maybe if you already experienced blood transfusion before, you already know how it feels. Or if not, maybe some of your family members experience this one. You can ask how is the feeling or how is the process of undergoing blood transfusion. Okay, so usually this being given if there is injury or surgery. Okay, if the doctor deemed that there's going to be many blood loss during surgery, we usually prepare two bags of blood already for backup during the surgery. And then usually this one is being treated for those who have for those who are sick or blood related cases. Okay, transfusion reaction or agglutination, clumping of blood cells. Your antigen molecules on surface of your erythrocytes. While your antibodies, these are your protein in plasma. Blood groups, name according to antigen or our ABO, just like this one. So blood type A, B, AB, and O. My blood type is this one, AB. Antigen is A to A, B, A, and B. And then your blood type doesn't have antigen. Your blood type O, it doesn't have antigen. Now, antibodies, of course, it's going to be the opposite. So your blood type A, the antibody is anti-B. Your B is A, while your AB, it doesn't have. Your O is your anti-A and B. So the most common blood type here is your O. Second is your A. Third is your B. And my blood type is rare, which is the fourth among the last among the 4 blood types. Okay, as you can see here, another illustration of RBC, A, B, A and B, and then this is your, it doesn't have antigen. This is your O. Okay. You can read more of this one on your book. So this one as well. So O are universal donors because they have no antigen. Okay. And your type A can receive A and O blood. Your type B can receive B and O blood. Type AB can receive A, B, and AB blood, while your type O can only receive O blood. Okay, memorize this part. RH blood group. Your RH positive means you have RH antigen. As you can, as you read this one on your book, it is so-called RH. It's because it is being done with a rhesus monkey. Okay, 95 to 85 of population is RH positive. So antibodies only develop if an RH negative person is exposed to RH positive blood by transfusion or from mother to fetus. Okay, so example of RH reaction: if mother is RH negative and fetus is RH positive, the mother can be exposed to RH positive blood if fetal blood leaks through placenta and mixes with the mother's blood. Now, the first time this occurs, mother's blood produces the antibodies against your antigens. Any repeated mixing of blood causes a reaction. So this specifically, this defect is that is being done with the mother who are having positive and the baby is negative, or this is what we call your hemolytic disease of the newborn. Occurs when mother produces anti or negative RH antibodies that cross your placenta. Okay, that is because that is the port of the mother and the baby from receiving blood, oxygen, and nutrients, your placenta. And agglutination and hemolysis of fetal erythrocyte occurs. This can be fatal to the fetus. Prevented if mother is treated with RhoGAM. Okay, remember that medicine, RhoGAM, which contains antibodies against your RH antigens. Okay, so this is the illustration of a mother and a baby who is having opposite RH. Diagnostic blood test, we have your CBC, or what we call your complete blood count. Maybe some of you here undergone already some medical tests. So your complete blood count provides information such as your RBC count, hemoglobin, hematocrit, and your WBC count. The male usually have like 4.6 to 6.2 million per microliter, while the female will have 4.2 to 5.4 per microliter. So we also have here also your hematocrit. Hematocrit is the percentage or the percent of total blood volume composed of your RBC. Okay, hematocrit composed of your RBC. Your hemoglobin determines the amount of hemoglobin. If you have low hemoglobin level, it means you have anemia. Okay, hemoglobin for male is 14 to 18 grams per 100 ml, Well, female is 12 to 16 grams per 100 ml. Okay, so this is your hematocrit, in which it is being checked. Okay, so here your PB or your prothrombin time it takes for the blood to begin clotting. Usually it should be 9 to 12 seconds only. Okay, that is your prothrombin time. Your white blood cell count, the total number of your WBC, in which we've already talked its subcategories. So your WBC determines the percent of each 5 kinds of your leukocytes. Your neutrophils usually 60 to 70%. Lymphocytes is 20 to 25. Monocytes is 3 to 8%. Eosinophils is 2 to 4%. Your basophil is 0.5 to 1%. Remember, the most common is your neutrophil. The least common is your basophil. And that is all about your WBC count. So we have what we call the white blood cell disorders. We have your leukopenia. Leukopenia is low WBC count. This can be caused by radiation, chemotherapy drugs, tumors, and viral infection. Okay, your leukocytosis, high WBC count caused by your infection and also your leukemia. Okay, so these are the blood cell disorder, and this will conclude our discussion about blood. So if you have questions or clarifications, you can ask me on the group chat or in our Google Classroom. Okay, so I'll see you again next time. Thank you.